Would you be surprised if I told you 70% of teenagers don't get enough sleep? Well, I welcome you to this special interview where we will explore the neuroscience of sleep in teenagers and the cause of their sleep difficulties. I'm honored to be joined here today with Dr. Shadmand, who's a medical expert and who specializes in internal medicine and has had various experiences with the topic of sleep.
Well, thank you so much for that introduction. Like you said, I'm Dr. Shadman. I'm uh, internal medicine doctor, but transitioning to cardiology for through fellowship. I'm thankful for this opportunity to speak with all of you.
Thank you. So, in today's interview, Dr. Shadman will help us understand the science of sleep and common disorders such as insomnia and distinct phenomena such as dreams, nightmares, and also, lastly, I'm hoping he'll give us some tips on how to get better rest. So, to start off, many are wondering whether a lack of sleep truly impacts them, and sometimes its importance is underestimated. So, Dr. Shadman, could you please tell us why sleep is so crucial for teenagers and what is its importance, especially to your mental health?
It's not hard to tell how important sleep is. I mean, you all have experienced it when you don't have a good night's sleep, how you feel the next day, how it affects your cognition, how it affects your learning, and your mood as well. But today, I'll talk about a little bit of why those things happen and why that is important. For instance, one of the biggest effect that you will probably notice as a teenager in high school, and you have to learn a lot, you have to stick to a very regular schedule that often is not might not have been designed by yourself. Is that if you don't get a good night's sleep, the next day you have trouble focusing. The next day, you might have issues with recalling things and remembering things. One of the main reasons that might be is because sleep has an important role in getting rid of some of the toxins that accumulate in your brain throughout the day. And also, dreaming and sleeping in general helps with learning and developing those neuron connections that are involved in improving your cognition. Um, and that's why it's very essential. There is a lot of other things that happens when you sleep, which we'll talk about, and I know that we will be talking about it a little bit later in the talk. Um, but why do we need to sleep for these things to happen? I don't think it's quite known. For instance, why can't our brain clear all of these toxins throughout the day as we are sitting, talking? Not quite understood, but we know that it happens when we sleep, so that's why it's very important.
Right. So, as Dr. Shadman mentioned, sleep is very crucial for brain development and brain function, and it can also impact our physical and mental well being. And as you mentioned, it's also very essential for functions. But I'm sure there's still many teenagers who don't know how sleep truly works and what really goes on when you go to bed. So, could you now please explain to us how sleep works and the sleep cycle?
Yeah, absolutely. There are two aspects of why we feel tired and why we sleep. One of them is our internal clock, which we have probably heard circadian rhythm, which is our internal clock, which basically tells us when is nighttime, which is associated with sleep, and when is daytime, which is associated with being awake. And that is linked to numerous hormonal things that happens in our body, including growth hormones, stress hormones that are linked to when our body thinks it's a daytime or when our body thinks it's a nighttime. It's evolutionarily linked to those time frames because those time frames are when we are relaxing and sleeping, so our body can kind of decide what to do to itself when we are resting, or for instance, when we need to hunt or gather and do things, aka during daytime. A lot of growth hormone or stress those hormones peak around either near sleeping time or when we are sleeping, which are associated with muscle building and regulating and calming down our cardiovascular system when we are sleeping. So, as you can imagine, if you're not sleeping appropriately during those times when you need to have those things won't happen when they are supposed to. And during daytime, let's say when you're tired, even if you sleep, your body is not ready to do it. Therefore, it's not going to happen. Therefore, if you don't have good sleep, you might not have good muscle buildup. You might not have the benefit of cardiovascular effects that it will have on your blood pressure and heart rate and all those things will be disrupted, which can lead to a lot of diseases down the line. It can lead to obesity and things like that. The other aspect of when you feel tired is that as some of the metabolic byproducts build up in your brain, such as adenosine, throughout the day, that's another thing that can make you feel tired, which triggers initiation of sleep. So when those two are regulated, meaning that you feel tired at night and those neurotoxins build up at night, you're able to fall asleep and initiate a good sleep. And those are basically what can make you feel sleepy and initiate the sleep and keep you asleep throughout the night.
Adding on to the previous question, could you please tell us more about the sleep cycle? Because I'm sure lots of teenagers don't really know what the sleep cycle is. So,
Yeah, of course. So I typically would rather to call this sleep structure rather than sleep cycle, because it can kind of get us confused with our internal cycle, the circadian cycle. So sleep structure is, again, it's very important with the quality of sleep, associated with the quality of sleep, that for us to go through all those steps of sleep. It has to do with the level of consciousness and what our brain is doing throughout those times. And it is divided in non-REM sleep or REM sleep, which REM is acronym for rapid eye movement. As you can imagine, during REM sleep, which is rapid eye movement cycle of sleep, it is associated with rapid movement of oscillatory movement of your eyes while you're sleeping, and the non-REM sleep is when your eyes are not rapidly moving. There's at least could be some roving motions, but it's not rapid moving. The non-REM sleep, it's on its own, it's divided into three different stages of consciousness, which previously non-REM used to be divided into four stages, but now the recent subdivision is only three stages, and it categorizes N1, 2 through N3. And basically, as we go down these stages from N1 to 3, it is basically short and sweet of it is that we have lower and lower consciousness, basically deeper and deeper sleep. And as we start the night, like let's say you go to bed around 9:30, and the initial phase of sleep that you go into is N1. You go into non-REM sleep. That is the lightest sleep that you have. And then as the night progresses, you progress to N3. And during early hours of the night, you have more of those deep sleeps, N3s. And then you don't stay in there, you keep oscillate through these stages. And initially, during early nights, you might not go to REM sleep, which is that dream phase when you are able to dream more and you have those rapid eye movements. But as the night progresses towards the early morning, you replace those deeper sleeps. The frequency of those deeper sleeps will go down, while the frequency of those REM sleeps, which are associated with dreaming, will go higher and higher.
so as you explained the sleep structure, as you mentioned, um, it's noticeable that we range from light to deep sleep, and the difficulty waking someone up from those stages also vary. So, why is it that most teenagers never feel rested when they wake up, and does this relate to the sleep cycle?
Yeah, so as you mentioned, yeah, that's absolutely true. There's certain, like I said, it's associated with how conscious you are, how level of consciousness depends on how active your brain is during that time. N3 is the toughest one to wake somebody up. It is still possible, but it's they're the least conscious. They have, if you measure the brain activity, it's very, very minimal during that time. And typically it's associated, if you wake somebody up during those deeper stages, um, they probably won't feel as well rested. It's mostly because if you're going to N3 a lot, those are early phases of your sleep. So your brain is not done completely with recovering from whatever use that you have had throughout the day with your brain. So that's during the time that your brain is actively removing a lot of toxins from the brain. That is N3 is the phase that, um, based on the studies, your brain is highly active in removing toxins by increasing those specific glial cells that are involved in filtering through the water molecules and some of the other toxins. And if you're not done going through all those stages, then that basically your brain is not done cleaning up the environment. So that might be why you're not well rested when you wake up during that time.
Okay. So adding on to what we just discussed, we've also had many students talk about their own experience on sleep, and let's take a moment to hear from them.
Recently, I've been sleeping extremely late, anywhere from 12 to 2 a.m. I have many extracurricular activities and also sports. And then by the time I get home, I have to do some schoolwork. So in the end, I end up sacrificing a lot of my sleep.
It's mostly mostly the schoolwork. I see the pressure you feel from competition. That's what really keeps me up at night, and really it doesn't seem to go away because you keep wanting to get better, and really at nighttime you see it as extra time that nobody has. That's why you stay up late.
So even when I have intentions of going to sleep, I always have so much stress buildup of all the things I have to do the following day, and it makes it much more harder for me to go to sleep.
Right. So as stated by many of the students, it's clear that lots of them struggle on going to sleep even when they try to go to bed early. And it's almost all students that face these challenges. And I feel that this raises an important question regarding the changes in their sleep pattern. And that question is, how does the circadian rhythm, as you mentioned, how does it change in teenagers? And what will their natural rhythm be?
Absolutely. So the circadian rhythm isn't as different between an adolescent person than in comparison to an adult. It's slightly longer. So the circadian rhythm, instead of being a full 24 hours, exactly 24 hours like a normal day, in adult it's 24.2 hours, so still a bit overshoots. And in adolescents, it's a little bit even longer, 24.3 hours. So as you can imagine, like let's say if they give you some sunlight today and we put you in a cell that you don't get sunlight, so your body is supposed to kind of regulate its own nose when it's the day or regulate its hormonal activities without exposure to external stimuli. uh, it's going to overshoot. It's going to overshoot and it's going to go be off every day as the day goes by. But fortunately, if you go outside, you get sun, so your body's able to reset itself. Every morning that you wake up, you see the sun, your body's be like, okay, I overshot a little bit yesterday, but it's actually early morning now rather than, I don't know, a few hours before that your body thought, because it overshoots a bit every day. That's how the circadian rhythm works. But aside from that, I don't think in most of the teenager, it's not an issue with off balance in the circadian rhythm that we have trouble with sleeping unless you travel a lot, that you're jet lagged, your internal clock is offset from the actual clock that you're trying to go to sleep. I mean, you're mostly in the same city, you're going to school, you wake up in the morning, you get exposure to sun. So I don't think that's an issue there. So most of the time in teenagers, the reason they have trouble with being excessively tired is either with the duration of sleep or the quality of their sleep. I mean, you have a lot of reason to have both of those impaired. You have a lot of exams, a lot of tests, a lot of homeworks, a lot of anxiety, a lot of stress, and all of those things affects both duration and quality of your sleep. How that happens, obviously, if you're not getting enough sleep, you're not going through all those stages of sleep that are necessary for clearing the toxins from your brain, uh, building memory, forming all those appropriate synapses in your brain when you're dreaming. So if you're not able to do that completely, the next morning you're not very, very well refreshed. And it's going to continue on throughout the week.
Right. So as you mentioned, because of school, students miss a lot of their sleep, maybe because of projects, exams, or stress. And so could you please tell us what in turn will be the consequence of school disrupting their sleep time or their sleep structure and them missing those important hours?
Yeah. Honestly, I think the students will know better than I do how it affects them. But like I mentioned, the role of sleep is to resume some of those metabolisms that happens only during the nighttime. And if you're not getting those, um, physiologically, for instance, if you're not getting those peak growth hormones that happens throughout the night, it can affect your height, muscle buildup, all of those things that are associated with that. If you're not having those regular regulations in your cortisol or other stress hormones that is supposed to happen before sleep and early in the morning, then it can disrupt a lot of things. It can disrupt metabolism, which can lead to obesity and diabetes, and long term it can have lots of negative cardiovascular effects as well. But those will all take some time for it to develop. But the earliest things that you will notice is that it'll affect your cognition, as we talked about it earlier, and it can affect your mood as well. That's the depression and anxiety is both cause and effect of poor sleep. So it can lead to poor sleep because it also has shown anxiety specifically has shown to reduce that N3 phase of sleep that we talked about per se specifically. And if you're not able to get, even if you're having good length of sleep, if you're always anxious, that quality of sleep is not going to be as good as somebody who doesn't have anxiety. Might sleep 6 hours a night, but it's not going to be good quality of sleep. And that again is going to make you depressed throughout the time. It can cause depression, and also it can impair your whatever goal that you're trying to achieve because your cognition is not quite there. And then again, kind of like becomes like a really, really bad cycle.
And also, I've seen that many teenagers rely on naps, and in some cases, they sleep for 4 hours at night and then sometimes maybe 4 hours after school, and they believe this has the same effect as sleeping for 8 hours. So, can you tell us if segmented sleep has the same effect as sleeping for 8 hours or, 7 to 8 hours consecutively?
So, the short answer is no, and the reason is that because, for instance, it depends. Like if you're taking a nap, and at night you're still able to get the good amount of sleep that you need to, that's fine. But let's say if you take a nap, but then the nighttime comes and you're not just feeling as quite tired because you just slept and you're not able to get that good length sleep, long term it's not going to have the good effects of a solid night's sleep that you need. The reason is that because, again, that duration during the day, like let's say you take a 2 hour nap, is not long enough for you to go through all those stages of sleep. You might feel a little bit refreshed, but not completely. Your brain is not recovering completely. Now, how many hours of night sleep is enough? That depends. I know traditionally we have said 6 to 8 hours, but no study has shown that that's actually how much you need. Basically, the best indicator is that when you wake up in the morning, do you feel refreshed? If you feel refreshed, you had a good night's sleep. If you didn't, either that was not enough or the quality was not enough. Some people are sleepless, require less sleep. They sleep 4 hours every night and they feel very refreshed. That might be normal for them. That might be enough. But some people sleep maybe 10 hours and they feel refreshed instead of 8 hours, and that might be normal for them too. So the short answer is those fragmented sleep, it actually what happens in people who have sleep apnea, because they keep waking up in the middle of the night because oxygen level in the body drops. And because they snore a lot, they get obstruction up here and they keep waking up, even though the total hours are fine. Because they keep waking up, they don't go through all those stages of sleep and they feel tired during the day because basically they get involuntary fragmented sleep.
So now we're moving on to the next topic, which is one of the most common sleep challenges of teenagers, and that is insomnia. And I've seen that many students question whether they're experiencing insomnia. But first, could you explain to us what insomnia really is and if it's truly common among teenagers?
Yeah. Insomnia, by definition, is inability to initiate sleep or stay asleep. And it's not due to a secondary factor. For instance, if you have a brother who's making too much noise throughout the night and you're not sleep because of that, or a family member who snores very loudly and you cannot sleep because of that, that's not insomnia. Insomnia is that if the sleeping environment is okay and you just have an ability to fall asleep, or you fall asleep and you keep waking up throughout the night for whatever reason. That is insomnia. That insomnia could be chronic, meaning that long term it has been there for more than 3 months and it happens multiple times throughout the week, or it's acute, meaning that it's have been happening for less than 3 months for a short period of time. So that's basically the definition of insomnia, which we can talk about different causes and how to tackle it as well.
Right. So I've also seen that many students are confused between this. So how can they tell if what they're facing is temporarily sleep deprivation or if it's an actual case of insomnia?
Yeah. Sleep deprivation is that, you don't have trouble falling asleep, and you do stay asleep when you try to, when you fall asleep. But again, you wake up not rested. You don't have issue with the actual act of sleeping. So you're either not getting enough sleep or the quality of your sleep for whatever reason is not good. But insomnia is that, you just are not able to maintain a good night's sleep. The symptoms of both of those are going to be the same because you're going to feel tired the next day. So the difference is, why are you feeling tired? Are you not going to bed early enough because you have a big test? Or you're going to bed early enough. Let's say you go to bed at 9, but you don't fall asleep until midnight. That's a long time. You need to be able to fall asleep within 30 minutes or maximum an hour when you go to bed. So if you're able to do that, then you don't have insomnia. And like, let's say you're not waking up every 30 minutes or every an hour in the middle of the night, then you don't have an insomnia. You probably are tired because you're sleep deprived because of the quantity or quality of your sleep.
And for those who are actually facing insomnia, what might be the main causes of this sleep disorder? Could stress or academic pressure or, late screen use play a role?
Yeah, absolutely. Yeah, I think the one of the biggest one is the light exposure. I mean, we're chatting on computer, we use our cell phones, iPads, or whatever you're using. They have lights, and a lot of them have blue lights. And unless you have a blue light filter, you're getting exposure to that. And blue light is just a different wavelength of those visible lights that associated with resetting the circadian rhythm. Like I mentioned, naturally in ancient times, our circadian rhythm was only be able to be reset by sunlight. Now we have lights indoors, so it kind of messes up that as well. If you're having your screening in your phone, not only it's keeping your brain active because you're analyzing information, the light itself activates those neurohormonal photosensitive stuff in your eye that can reset that melatonin suppression and make you not be tired when you're supposed to be tired. The other thing, like we already talked about plenty, is the amount of anxiety you guys are on, the amount of homeworks that you have for the next day, and the competition that you have if you're an athlete or you're competing with your classmates for a grade. I mean, all those things will keep your brain up. Anxiety definitely impairs initiation of sleep and staying asleep, and also the quality of sleep as well.
And then to avoid these consequences that you've mentioned, how can teenagers manage and improve their insomnia with effective and maybe non-medical methods?
Yeah, there's a lot that you can do. Obviously, the school is going to remain stressful as is, and unfortunately, as you go higher in your grades, it's probably going to get worse for a good while until you have a little bit more experience with getting comfortable with tests and exams. And I think for me, it happened during college, but hopefully some of you are better than me and have gotten used to this, so that will help a lot. Obviously, if there's issues with time management and just having anxiety disorder, those needs to be paid attention to. I think anxiety and depression in adolescence are underdiagnosed. A lot of you have a lot of stressors in life that you're dealing with. But even if that needs medical treatment, I think that's the most important thing, because that not only improves your mood, it'll improve your sleep, it'll improve your performance in school, and you deserve to be happy. So it's important to pay attention to that too. But for other stuff, for instance, sleep hygiene is very, very important to get you the best quality sleep that you can get. What I mean by sleep hygiene is the time that you go to bed, and what you do prior to going to bed. And the other big thing is that you only need to use your bed for sleeping. When I was a teenager, my favorite place to study was just laying in my bed and just kind of study there because there was limited space. But try not to do that. Just use it as soon as you're awake. Get out of bed, make your bed and leave it there until you're tired next and you have to sleep. That's very, very important. The other thing is that try not to use your electronics or anything that keeps your brain active at least an hour prior to the time that you have to go to bed. So that kind of gives you a chance for your brain to slow down its wave activities that is supposed to happen before you feel tired, and you cut out that blue light exposure as well. Try not to eat like maybe 3 hours before you go to bed because that will reset some of those hormonal axes that will negate the things that need to happen prior to for you to be able to fall asleep. Some of the hormones gets released that kind of suppress the other hormones that need to be released for you to fall asleep. Something that can actually help is working out in like maybe 2 hours or 3 hours before you go to bed. That gets you a little bit tired, it gets rid of that extra energy, and you just basically, as it's common sense, you will feel tired, so you will be able to fall asleep and maintain that sleep better. Those are a few things that you could do to improve your sleep quality and to be able to be more refreshed the next day.
So moving on to the next topic is sleep phenomena and the most common sleep phenomena that teenagers face. And with the help of a survey, we've gotten results from ISLQ students. And seen from the results was that 47% of the students faced nightmares or night terrors. And so, Dr. Shadmand, why do you think the reason teenagers face so many nightmares, and how can they reduce this?
Night terrors and nightmares are very different. They happen in different phases of sleep. Nightmares happen in REM sleep during the time that you're dreaming. Night terrors happen during the deep sleeps, like N3 or sometimes N2 as well, depending on the cause. But let's talk about nightmares because they're a lot more common. Nightmares are a little bit also different from bad dreams. Not all bad dreams are classified technically as nightmares. Nightmares are the ones that are bad enough that will wake you up from sleep. For instance, you jump up because of the bad dream. That's a nightmare. A bad dream could be just as unpleasant, but you tend to recall them when you're awake. They don't wake you up in the middle of a sleep. So those are two different things. And let's talk about these a little bit. And again, things that are associated with it are going to be, like I'm going to be repeating myself again, a lot of anxiety and daytime worries can lead to this or associated with it. There seems to be some genetic predisposition to it. People who are more sensitive to anxiety-inducing things tend to have more of the bad dreams with typical daytime exposure to anxious stimuli than some other people. Some people might have also similarly very anxiety-inducing daytime lives, but they're not typically associated with having nightmares as much. There are pharmacological treatments with it as well, but as far as things that you can do for non-pharmacological things to reduce the amount of those, again, is going to be able to treat the anxiety and being able to have a better time management with the stuff that you need to work on, and ask your teachers to be nicer to you and give you less homework, I guess. But I don't know how realistic that is in a busy high school life. But that's one thing. And the other thing that you mentioned, the night terrors or other non-REM sleep disorders. Non-REM sleep disorders are mostly enactment of your sleep that are unpleasant, and they happen during non-REM phase. Things that you are associated with it could be sleepwalking or night terrors. Basically, you won't. The diagnostic criteria for that is that you have these abnormal physical complex movements, meaning that you walk around in your sleep. They're complex things. They're purposeful but complex, and you have minimal recollection of those things because you're during your deep sleep and you have minimal responsiveness to them. That is mostly associated with poor sleep quality rather than quantity. And it has to do with a lot of genetic predisposition as well, especially with sleepwalking. But again, a lot of anxiety, if it leads to poor quality of sleep, can lead to these as well, especially in teenagers. In adults, significant alcohol consumption or some other drug use can lead to this as well. But in teenagers, the things that I mentioned are the most common cause.
Thank you. So, lastly, from the survey, we've seen that 67% of the students in total either forgot their dreams or frequently remember their dreams, and both nightmares and dreams, as you mentioned, occur in the REM sleep stage. So, why is it that certain dreams and nightmares are forgotten while others are vividly remembered?
Yeah, the biggest theory is that depends on when you wake up in relative to when you had that dream. For instance, if you wake up during your REM cycle, you just had that dream, there's a good likelihood of you remembering that dream. But let's say you had that dream in the initial phases of your REM, like let's say the first REM phase that you had earlier, like let's say around 2 a.m., and you wake up at 6 a.m., and that is during your N1 or N2 phase, which is a little less likely in N2. Then there's a lower likelihood of you recalling those dreams. But again, the shortest answer is depends on when you woke up.
So, to wrap up this interview, Dr. Shadmand, could you please give some key advice to teenagers who are struggling with their sleep and some tips on how they can have better rest?
A lot of it is going to be with being able to manage your anxiety. I think that's at least for me, that's the biggest thing in high school. And aside from, make sure you're doing all that there is, that you do not leaving things to the last minute, dividing every homework that you get, every task that you have in a good timely manner, so you're able to do them accordingly, so you don't have to put everything for the last minute. That can essentially ruin your sleep for a couple of days, which can have significant impact for the following days after that. Do everything you can. Obviously, I understand that. I mean, there are going to be time that you're going to have sleepless night from a topic that is very stressful that you have to study about it. But do everything that you can. But let's say you're doing everything that you can, but you tend to have inappropriate anxiety response to something that your colleagues are dealing with, but you seem to be taking it too much harder. Maybe see a doctor and have a proper diagnosis whether you have actually anxiety or not. If you do, treating that appropriately can be very helpful. There's a lot of stigma against like anxiety and depression, and it's underdiagnosed in adults as well, but it's a lot very ignored in adolescents as well, because we expect adolescents to be always happy, smiling, not worrying about anything. But the current lifestyle is not like that. We worry about a lot of things, and if you actually don't worry about things, that sometimes put you behind in high school. So that's important to pay attention to. The other things that I mentioned already: exercising, having a healthy diet, paying attention to when you do those things before you sleep, and not doing it right before you're about to go to bed, not eating and not maybe being super active like an hour before you sleep. Those can be very helpful. Using your bed just for sleep, limiting screen exposure an hour or two before you go to sleep, and maybe listening to a very, very relaxing music before that. That could help get your mind at ease a little bit, relax you a little bit. That could be helpful as well. Those are the big recommendations I would have for a teenager that is short of medications for helping get sleep. But occasionally, which is very rare in adolescents, but there could be other disorders that is leading to your sleep disruption. Like let's say sleep apnea. Some people genetically can have narrow airways that can get even narrower when you sleep because you lay flat, and they can disrupt your oxygen flow. If you're somebody who snores a lot at night, you could have sleep apnea. Okay, having appropriate evaluation for that would be important, because if you treat that, then your sleep will get better, your mood will get better, your performance in school can get better as well. So those are the big things that I have for you.
I see. Thank you so much for being here and sharing your expertise on the science of sleep. It was a lot of help. And to all students watching, thank you for watching the video, and I hope all your questions have been answered. And I hope this video was helpful. And again, thank you so much, Dr. Shadmand, for all your help and for being here.
Of course, yeah, my pleasure. Thank you for having me. Good luck to all of you. Sleep well tonight.